This combination hormone medication is used to prevent pregnancy. It contains two hormones, norethindrone, a progestin, and ethinyl estradiol, an estrogen. There is a small amount of iron, ferrous fumarate, in each of the 7 inactive tablets taken during the 4th week. The inactive pills do not contain any hormones. These tablets are meant to keep you in the habit of taking 1 tablet each day and do not have enough iron to treat iron deficiency. Besides preventing pregnancy, birth control pills may make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and also treat acne. Using this medication does not protect you or your partner against sexually transmitted diseases, such as HIV, gonorrhea, chlamydia. Before starting Loestrin Fe, make sure to read the patient information leaflet provided by your pharmacist. This leaflet contains important information on when to take your pills and what to do if you miss a dose. It is important to take this medication by mouth as directed by your doctor, usually once daily at the same time each day. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow. It is very important to continue taking this medication exactly as prescribed by your doctor and to not skip any doses. If you experience vomiting or diarrhea, you may need to use a backup birth control method. Taking this medication after your evening meal or at bedtime may help if you have any stomach upset or nausea with the medication. Your pill pack contains 21 pills with active medication and 7 reminder pills with iron. You should have your period during the 4th week of the pack. If you are taking certain medications that can interact with iron, ask your doctor whether you should throw away the reminder pills each day rather than taking them. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. If you are switching from other forms of hormonal birth control to this product, consult the patient information leaflet or your doctor or pharmacist for more information. If you experience nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change, these may be side effects of Loestrin Fe. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, please inform your doctor or pharmacist immediately. This medication may also raise your blood pressure, so be sure to monitor it regularly and notify your doctor if the results are high. If you experienced serious side effects such as lumps in the breast, changes in mood, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes/skin, contact your doctor right away. Additionally, seek immediate medical help if you experience symptoms of blood clots such as chest/jaw/left arm pain, confusion, sudden dizziness/fainting, or vision problems/changes. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist for any other effects you may notice. If you smoke cigarettes or use tobacco and are over 35 years old, it's important not to use Loestrin Fe. This is because smoking can increase the risk of serious health problems such as stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control like this pill. The risk of these problems increases with age and the number of cigarettes smoked. It's essential to avoid smoking or using tobacco while taking this medication. Additionally, it's important to keep this product out of reach of children, as accidental overdose of iron-containing products can be fatal in children younger than 6 years old. If an overdose does occur, it's crucial to seek medical help immediately or call a poison control center. In terms of the best time to take this medication, it's typically recommended to take 1 pill every day at the same time. It's important to follow the instructions provided by your healthcare provider and to take the medication consistently to ensure its effectiveness. Before starting Loestrin Fe, it's important to discuss any allergies you may have with your doctor or pharmacist. Also, make sure to share your medical history, especially if you have a history of blood clots, high blood pressure, heart problems, diabetes, gallbladder problems, or thyroid issues. If you have diabetes, you should monitor your blood sugar regularly and discuss any changes with your doctor. If you're planning to have surgery or will be confined to a bed for an extended period, be sure to let your doctor know, as this may affect your use of Loestrin Fe. Additionally, this medication can cause dark patches on your skin, so it's important to limit your sun exposure and use sunscreen. If you wear contact lenses, you may experience vision problems, so contact your eye doctor if this occurs. It's also important to note that it may take longer to become pregnant after stopping birth control pills, so consult your doctor if you have any concerns. Lastly, Loestrin Fe should not be used during pregnancy, and it may decrease breast milk production, so be sure to talk to your doctor if you are breastfeeding. When taking Loestrin Fe, it's important to be aware of potential drug interactions. Some products that may interact with this drug include aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. There are also some drugs that may cause hormonal birth control to work less effectively, leading to a potential risk of pregnancy. These include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs, among others. It's crucial to inform your doctor when starting any new drug, and discuss if you should use additional reliable birth control. It's also important to notify your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working effectively. Additionally, Loestrin Fe may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are using this medication. It is also recommended to take this medication at the same time every day, with or without food. If you or someone else has taken too much Loestrin Fe and experiences severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call 1-800-222-1222 for your local poison control center, and in Canada, contact a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. If you suspect an overdose, seek medical help immediately. It's important to remember not to share your Loestrin Fe medication with anyone else. Make sure to have regular physical exams, including lab tests, while taking this medication. This may include blood pressure checks, breast exams, pelvic exams, and pap smears. Follow your doctor's instructions for examining your breasts, and report any lumps right away. It's crucial to keep all medical and lab appointments and consult your doctor for more details. If you miss a dose, consult the package information for guidance on what to do. You might also need to use additional birth control methods, like condoms or spermicide, to avoid pregnancy. Don't hesitate to ask your doctor or pharmacist if you have any concerns. If you have trouble remembering to take your pills on time, it's a good idea to talk to your doctor about switching to a different type of birth control. Make sure to store Loestrin Fe at room temperature and away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, make sure to properly discard it when it is expired or no longer needed. If you have any questions about how to dispose of Loestrin Fe, be sure to consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.